supervisors. I want to move along now to some questions that will be pointed towards the Veteran Affairs. So this will be back to you, Dr. Thompson. So I have to, this has a long preface because this was actually submitted by one of our reporters at Military.com, Bryant Jordan, and he pointed out that the suicide rates among younger veterans seems to be lower, significantly lower than the older veterans, and he also pointed out that the rate is cut in half again by the amount of activity these veterans have when dealing with the VA for healthcare issues. So he would like to know if you have any opinion on why this is the way it is.
Sure. Yeah, and I think that maybe we need to just quickly do an education on a rate versus like the numbers. So what we know is of our veterans who die by suicide each year, over 70% of them are over the ages of 50. Our rates of suicide, though, of our youngest veterans, and this is the same population that Jackie was talking about, those 18 to 26, 27-year-old young men, those rates are actually increasing. And the rates of the older veterans are, in fact, staying the same and even going down a bit. So, so there are a lot of different reasons why this may be. We know that in the general population, middle-aged to older adults, particularly white men, they tend to have the highest suicide rates. So many reasons for that may be that they're dealing with significant transitions in their lives. Perhaps they are losing a spouse, or they're having more medical problems. They might have retired from their job and are struggling with a sense of purpose. And then with our youngest veterans, those rates may be are increasing, we think, because they're not getting into care right away after they separate from the service. And so what we do know, though, is that treatment works, because another piece that we have found is that those veterans who receive care at the VA have lower rates of suicide than veterans who don't receive care at the VA. And I think that that speaks to, first of all, the fact that the VA's suicide prevention system and structure seems to be working in some ways, and we're trying to figure out exactly which ways. But I think it also speaks to the fact that these folks are getting into treatment, and we know that treatment works. We know that when you get into treatment, you will feel better. So much of what we're doing is we're both targeting the populations for whom we're most concerned, which is our older veterans, particularly Vietnam veterans, as well as those very, very young veterans. We're also very, very concerned about our women veterans, and their suicide rates also seem to be increasing. They tend to use firearms more than non-veterans, and firearms are the most lethal way to die by suicide. If you use a gun as a way to die by suicide, there's a 90% chance that you will die. Whereas if you take medications, it's more of a 2 to 3% chance. So we're focusing on all of these different things, but lots of reasons to look into and try to better understand.
I appreciate that. I'm glad you clarified the difference between the trend and the numbers themselves.